Good afternoon, Peter Goertz here. I'm a psychiatrist, and I'm on call this weekend, and something struck me again that struck me over the years, and that is how important it is to touch people. We're human, and babies die if they're not touched, so touch is very important for human beings, and that includes psychiatric patients. So today I saw a patient who was felt to possibly be catatonic. I walked into a room, an older lady, and she wasn't talking. I asked her a question, she didn't answer. She seemed pretty sleepy. And then I just took her hand in mine, gently, and started talking with her. And then gradually she started talking. So that reminded me how important that issue is and how basic an issue it is for human beings to be touched. It's just a basic human need to be touched. And the other side of that is, if you do that, patients don't feel, quote, untouchable. So they feel more accepted, I think, in general, if they know that you feel comfortable touching them. And that includes shaking their hand if you meet them, doing a physical exam if necessary. Now, there are exceptions. So if a patient is obviously paranoid, you do not want to right away touch them and physically examine them or shake their hand, because they may react very aggressively, potentially. So you want to gauge things, you want to go with what feels right to you and get a sense of the patient first, at least glance at the patient first, get a sense of whether it's okay to touch them. And of course, if a patient has grossly dirty hands, you're not going to want to touch that patient. You know, if you see feces on the hand, of course, you're not going to shake their hand. And another aspect is, if you get a sense that a patient is sexually interested in you, you want to be very careful. I mean, shaking their hand when you greet them, fine. But if they ask you for a hug, for instance, you want to be very careful and really probably not hug a patient who you know may be sexually interested in you. In general, I've hugged some patients over the years if they've asked for it, and that's been fine. Usually it's a very benign thing and people just enjoy the warmth. But you want to be careful. And also, if a patient is grossly agitated, of course, you don't necessarily want to touch them. Another thing that struck me today, another patient I saw today is an IV drug user. And I shook his hand when I met him because I feel, like I've just mentioned, that it's a nice thing to do, it's courteous, and it also shows people that they're not, quote, untouchable, etc. So this was a gentleman, a chronic IV drug user, and then I caught myself thinking, oh, could I catch something from him? HIV, hepatitis C. So that is not something to be afraid of just by shaking someone's hand, unless there's gross body fluid on the hand. So if you see blood on the hand, I would not shake the hand of an IV drug user. So in general, touch seems very important, and my experiences today reminded me of that. Thank you.